I was on vacation and I became very disoriented and I could not balance myself without assistance.
I had to take them to the emergency room and they couldn't find anything wrong with them.
They did blood work. The results came back positive for Polycythemia Vera.
And what that can mean to a patient is increased risk for strokes or heart attacks or blood clots in the veins.
Some of the things I've done is increase my physical activity. I engage with a nutritionist. I feel like I've been given a new lease on life. My wife and I have always enjoyed travel.
We are not people who just sit around and live life in one place. We have lived all over the country and we love to travel, to go to Europe, to do new things.
I grew up here in Central Florida on the water. I grew up sailing and fishing and boating, and as I got older, I got interested in scuba diving. So on I believe it was my 55th birthday, we all got certified with our open water diver for scuba.
It is a nice place to dive. He got me involved in diving. He got our whole family involved in diving.
Before I was diagnosed, I was not comfortable taking my boat out and going fishing like I love to do. I never knew when an episode was going to hit. I was going to become dizzy, disoriented, or have double vision.
And I think the biggest fear was we just didn't know what was wrong, why he was having these attacks on a regular basis. And it seemed to get worse and worse and worse. And I was getting to the point where I was thinking that we were going to have to change our lifestyle.
It was really confusing for me to not be able to be as active as I was used to being. It became depressing after a while. My name is David, and I have Polycythemia Vera, or PV.
And what that can mean to a patient is increased inflammation and drive and increased risk for cardiovascular events. That could be thrombotic events such as strokes or heart attacks or blood clots in the veins such as a pulmonary embolism. It can also lead to symptoms. So we know that patients often will present with itching or constitutional symptoms like fevers, chills, night sweats, bone pain. Sometimes the spleen can get slightly enlarged in this condition as well.
My first experience with the PV symptoms was one day at work. There was a fire drill. I was outside standing with a couple of friends. We were talking. I got very lightheaded, dizzy, and I had to sit down. After I sat down and felt a little better, I went to my primary physician. He checked me over, didn't find anything wrong, said he thought I was dehydrated, gave me some fluids, and then sent me on my way. In 2022, I was on vacation in Chattanooga, Tennessee. We were at Lookout Mountain preparing for a hike with the ranger, and I became very disoriented in the ranger's office, and I had to sit down. I was dizzy, I was seeing double, and I could not balance myself or could barely walk without assistance. I got very scared at the time.
And that's when I had to take him to the emergency room, and they put him through a bunch of tests to see what was going on, and they couldn't find anything wrong with him. And again, they said dehydration.
After I left the hospital, the symptoms became more frequent and more severe. They impacted my balance and my freedom of movement. And I got to the point when I would do my morning walk, I had to use hiking sticks to keep my balance, because without them, I could not be sure that I wouldn't fall down on my walk. So this began happening so frequently that I didn't leave the house. And for somebody like me who enjoys a very active life, that was just a terrible situation for me to be in. And again, I didn't know what to do.
I think 7 years probably is a little bit on the long side to go without a diagnosis. I think more so there's patients that don't get routine lab work done that are having vague symptoms that don't necessarily dovetail nicely with a rare disease diagnosis.
When I turned 65, I started Medicare and had to pick a new primary care physician. I went to see him for my initial appointment. He did blood work, and as soon as he got the results back, he told me, "You have polycythemia vera. I'm pretty sure of it. You need to go see a hematologist right away."
So one nice thing for diagnosis is that virtually everyone with polycythemia vera does have a JAK2 mutation. Classically, it's a specific mutation called the JAK2 V617F mutation. That's seen in about 95% of patients with polycythemia vera. The remainder typically have what we call a JAK2 exon 12 mutation, which is seen in around 3 to 5% of polycythemia vera patients. But by and large, everyone with PV does have a JAK2 mutation. Patients with PV have a pretty decent prognosis in terms of they live for a long time with this disease. Some of the critical kind of outcomes we're trying to prevent, disease progression, thrombotic events, these don't occur super frequently. Maybe they occur in the terms of thrombotic events, maybe 1 to 3% per year. With progression of the disease, we see that happen in maybe 20 to 25% of folks over a 10 to 15 year period.
I got an appointment with a hematologist. They did blood work. The results came back positive for the JAK2 mutation, and that confirmed that I have polycythemia vera or PV. They began phlebotomy that day. I did one phlebotomy a week for 3 weeks. After those 3 phlebotomies, the symptoms decreased significantly. I felt so much better and was happy that my doctor had recommended me see the hematologist. After the initial visit, I would go in monthly. They would perform another phlebotomy. This was happening on a very regular basis. As happy as I was to finally understand what was happening, it became a burden, and it just felt like I was handcuffed to the medical system. I did my own research, became my own advocate, and I found a clinical study that was looking at a new treatment for polycythemia vera. After about 3 months of taking the medicine, it occurred to me that I had my life back.
So David, I think, is a great encapsulation of both the challenges and the successes we see in treating polycythemia vera. And when we think about kind of what are our goals of treatment and how this affects patients, I think we can think about polycythemia vera from the side of a cancer. It is a type of a blood cancer, a chronic blood cancer, but you can also think about it from the framework of a chronic disease. And living with a chronic disease has all sorts of different kind of challenges. When you wake up every day, you know you have this. I think, with cancer, there's this idea that like maybe if I get treatment and I get a cure, then I can move on with my life. But with chronic cancers or chronic diseases, that may not be the case.
I feel like I've been given a new lease on life. I certainly am not taking life for granted as I may have done before. Some of the things I've done is increase my physical activity. I engage with a nutritionist to improve my diet. I started taking classes at the local Y for cardio and for strength conditioning and training, and I've just seen such a great improvement in the way I feel overall and feel like I'm excited about what life has to offer.
One thing about polycythemia vera is when it's well managed, when it's well controlled, patients can oftentimes live a very normal lifespan, close to a normal lifespan on average. And that quality of life really differs from patient to patient, but our goal is to have patients continue to be functional with their families and their communities, getting to do the things they want to do.
His health is excellent. I mean, he works out, he eats right, he sees the doctor when he needs to. He's active with his friends. He has a good community. So all of those things are very good. We joke around a lot about we're living for our 90-year-old self. I think the most important thing is we want to be there for our children and our grandparents.
One of the biggest blessings I've had on this journey is my wife, Dale. She was my advocate early on. Anybody who has been diagnosed with a serious condition like Polycythemia Vera knows how confusing it can be when the doctor is telling you what you have and what needs to be done. She was with me every step of the way in the early meetings with the hematologist, and she continues to be my advocate.
We have certainly work to do. I think we're still looking for ways that we can more deeply modify the underlying disease and reduce the risk of this disease progressing, potentially kind of get a cure, right? Or at least a functional cure, as we often say when we're unable to achieve a complete cure.
Come on, let's go. Let's go for a walk.
But I think the science is certainly there. I think the investment from the investigators as well as the pharmaceutical communities and even advocacy groups, I think is at its peak right now. And so I'm very motivated and very optimistic to think we're going to make real changes over the next few years to really not only improve how patients live with their disease currently, but also maybe improve how they live down the road as well.
PV has really helped me to prioritize my life, to make sure I'm spending time with the people I want to be with, doing the things that I want to do, and getting the most out of life. It is possible. Recently, I was able to hike on the Appalachian Trail for 150 miles with a couple of friends. I'd like to encourage people to live a full life. Don't let this condition hold you back.